How do antibiotics work in the prostate for prostatitis? Imagine fighting off an infection deep inside the prostate gland. That's what antibiotics do. They target bacteria causing prostatitis by killing them. But for antibiotics to work effectively, they need to reach the bacteria inside the prostate tissue. The prostate has a unique environment that can make this tricky. It tends to be slightly alkaline and has limited blood flow in some areas, which can restrict how well antibiotics penetrate. Certain antibiotics are better suited for this job because of their chemical properties. For example, antibiotics that are fat-soluble and have a high pKa can cross the prostate tissue more easily. When someone has acute bacterial prostatitis, the prostate becomes inflamed, which actually makes it easier for antibiotics to get in. During this time, most antibiotics can penetrate effectively, except for some like nitrofurantoin. Common choices include fluoroquinolones, such as ciprofloxacin, and tetracyclines like doxycycline. These are selected because they can reach high enough levels inside the prostate to kill the bacteria, mainly strains from the Enterobacteriaceae family. Treatment usually lasts from 2 to 4 weeks for acute prostatitis. Doctors often base their choice of antibiotic on urine cultures and sensitivity tests to make sure they target the bacteria responsible. For chronic bacterial prostatitis, the infection is more stubborn, and bacteria can hide in parts of the prostate that are harder to reach. Because of this, treatment often extends to 4 to 6 weeks. Fluoroquinolones are, again, a common choice because of their ability to penetrate the prostate tissue well and their broad antibacterial activity. It's important to understand that prostatitis can cause inflammation that might raise prostate-specific antigen levels. However, these levels usually go back to normal after the infection clears up. That's why doctors typically avoid testing PSA during an active infection to prevent confusion with prostate cancer. In summary, antibiotics work in the prostate by reaching the bacteria inside the tissue and killing them. The effectiveness depends on choosing the right antibiotic that can penetrate the prostate, the type of bacteria involved, and how long the treatment lasts. Proper antibiotic use is essential to clear the infection, reduce symptoms, and prevent complications. Always consult a healthcare professional for personalized advice, as each case can be different and requires careful management.